Did you interact much with the board, with the community board? What was your impression of, what they were like? Were they helpful? Were they intrusive?
I very much agreed with the idea of a board philosophically. In reality, it was difficult because they didn't understand really what a health center was, what it took to run one. I remember that they were upset because Rick didn't wear a lab coat and I didn't wear a nursing cap. Oh, they wanted you to wear a tie. I remember that.
Do you think they understood your role? Since
No.
this was something that was really new.
No, it was. It was really new, and for the most part, the women appreciated it a lot more than the men. I mean, the people were still coming in asking for penicillin for colds and stuff, and then they would say, I would try to explain why we couldn't do that, and they would say, "Oh, I understand. You're just a nurse. You can't do that. You can't give me penicillin." So there was a lot of that, a lot of difficulty in understanding the role. Yes, we were kind of pioneers, and there were times when I thought being a pioneer really sucked. And the board, like I say, I didn't realize really what the board, how it got to me until I moved to Oak Ridge after I'd been there for, I guess, about 2 or 3 years. And I didn't go to board meetings anymore, and everything was so calm, and I just felt so much more relaxed once I didn't have to go to board meetings.
Well, I think one of the issues back then, and one of the major differences that we discovered when we went up there, now that Mountain Peoples is so successful and so huge, was the fact that we had 3 clinics with 3 completely separate community boards, and each of them had their own ideas about how things should go.
Absolutely.
And trying to get those people to, each in a different county. And I think we rapidly realized that one of the reasons Mountain Peoples has been so successful is that every one of their clinics are now in Scott County.
Mm-hmm.
And
So they have one board for the whole?
They have one board.
Yeah, that would make
for everything.
That would make life much easier.
Yeah.
And I think probably things are a little bit more urbane now than they were back then. I mean, people just did not. We still had doctors in the area who didn't explain things to patients, and would everybody that came in that wanted penicillin got it, along with some Benadryl in case they had a reaction. And so we were dealing not only with a new role, but we were kind of going against the grain of what all these people had been used to for so many years.